mindset. Being this fact that we've all worked hard to get to this point in life, to what I call the top of Maslow's hierarchy, that area of self-actualization. And what do? We fall into lateral living. And away go those forced adaptation or challenges, those things that kept us sharp and inspired and motivated, right? It's the carapace of comfort. So what Mike and I are doing is collaborating here, and what I think is a small but historic moment. After the pandemic, this is the only in-person, male-focused event that I'm aware of happening in Milwaukee.
Awesome.
Yeah, and I think we're here to announce and to celebrate a whole new era of medicine and a whole new era of men's health. You know, the CDC&P says that you have 80% control of your health fate based on what you eat, what you drink, how you sleep, who you associate with, etc. And what's really exciting, and what I get excited about in my work, is I get to help guys acquire the tools and the knowledge to do something that historically men haven't done in this country, which is go to the doctor, actually listen, acquire some skills, and then go out and be in command of your own health, right? Now, so we're going to get into some of these common things that I do in my practice with guys. But I want to take a step back and look at the context that we're all waking up to each day. And I need to let you know that your wives are talking about you. Okay? I was late for my consult with Mike Carradines last week. Apologies again, Mike. Because 3 wives cornered me at the bakery in Whitefish Bay.
You got 3?
Not mine. Yours. The audience's. And they said, you know, you're that men's health guy, you know, blah, blah, blah. I start complaining about their husbands. I say, time out, ladies. Why do you think your guys aren't healthier? What do you think are the key things holding them back? And what do you think they said? Yeah, I asked them that. I said, time out, hold on, you know, you can complain all you want, but what do you think is keeping your guys, your husbands, from being healthier? And what do you think they told me?
You.
Time, lazy, stress. That was a big one.
For cooking.
Lack of cooking.
What else?
Work.
Yeah.
Attitude, whatever, you know, all that stuff.
He's stubborn.
Yeah.
He doesn't listen. He doesn't go to the doctor. When he does, he doesn't listen. He doesn't take his medication. He doesn't manage stress well. And he drinks too much. Are they right?
Sure.
Yeah?
Always.
Are they often right?
Always.
Yeah.
They're always
Yeah, well, they're monkeys.
You know who else is talking about you guys? The government. The government is spending almost 100-fold more money on women's health than on men's health in terms of research.
Is that because they listen?
It's probably because historically women have responded to medical marketing. You know, there are pink ribbons out there, but there aren't blue ribbons, right? Guys just aren't, they're not proactive that way. The government's talking about you. My staff is talking about you, saying that you don't fill out your paperwork, you often reschedule, you know, you're often disorganized. Culture's talking about you. When I get back from Borneo, I'll never forget, this is 5 years ago, I used to practice in Southeast Asia. And I went to Colectivo to get a coffee, and I was growing my hair longer and was thinking about putting it into a man bun, and I asked the barista, hey, how is that, like, wearing a man bun? And he said, you don't have to call it man bun anymore, it's a bun. We don't put the man on anymore. And I looked, but you're a man. He said, yeah, but we don't have to use that anymore. Culture is talking to you. Marketing forces think that all you care about are bills, boners, and biceps.
In that order.
In that order. Basically in that order.
Well,
Psychologists are talking about it. You know that it's estimated that 1 in 6 men, this is a sobering statistic, 1 in 6 men in America takes child molestation with them into adulthood. Has had some exposure to sexual abuse. Crazy. You never hear that. 1 in 6. 1 in 6 men has a history of sexual abuse if they take with them into adulthood. 1 in 7 working men has alcohol use disorder or is a high-functioning alcoholic in this country. Did you know that primary care, the number of residents going into primary care medicine is plummeting? Most are choosing specialties. The number of men who are going into primary care is plummeting. The number of men going into primary care who want to focus on men's health is plummeting. Longevity among men has dropped a little bit. We're 3 months, compared to 2 years ago, we're living 3 months less. You know that we're living less than women. There's still, every 46 seconds in this country, there's a heart attack. Every 60 seconds, we've got a cancer. Every 60 seconds, we've got a new diagnosis of Alzheimer's, dementia. And the sad part is that despite all these statistics, you're undereducated and therefore you're underserved as men. It's weird to sit here and think that we are an underserved community, isn't it? In the North Shore. It's true. There's an interesting statement in Asia I heard often from these wealthy guys I work with. Hey, doc, don't work so hard. Most men will use their health in the first half of life to gain wealth, only to turn around in the second half and use that wealth to try to regain their health. And I have to say to them, that's not unique to Asians. We're doing the same thing back here in the US. But we're doing it in a context that is largely set up for ladies, and not for guys. But what's exciting right now is I think we're at a historic point, especially post-COVID, where did you know that the average male responds with 2 to 3-fold more inflammation than females to COVID? Have you heard that?
No.
The only COVID long haulers in my practice are male. I don't have a single female COVID long hauler in my practice. There's all kinds of theories about this, one being that higher estrogen levels in women, which is a potent anti-inflammatory, is keeping inflammation down. But we're going to need to answer that moving forward. Why is it that guys had so much more inflammation during COVID? COVID has blown the old paradigm for medicine up. We're now able to do telemedicine consults all around the country. There's the right to try now, right? Where even experimental drugs we have access to as docs. You amazingly in America have the right to try something that's experimental. The question is, guys, are we getting on the bus? Are you getting on the bus of the new era of medicine? As men in men's health, it's here, it's happening now, and you can gain the competitive advantages that you deserve. And I want to talk to you a little bit about the mental and physical aspects of health that I work on with guys to give them those competitive advantages in my practice. The first question I ask guys when I'm taking them through our process is, what's your deep emotional why? Okay, so at the outset here, I don't think that the main barrier for guys to be healthier is actually anything that's doing physically. I think it's a mindset. I think that guys haven't been invited in the medical space or in general to talk more about their deep emotional whys. So what's actually pulling you? And what I find is when I can get a guy going on his deep emotional why, all the tactics and strategies that I add in there go further faster. So give me a deep emotional why for you. A why that says, you know what, damn it, doctor, this is why I want to be healthier. Most of us don't need to be. You're all sitting here, you made it here tonight, you're going on vacation, you're doing your job. You have to want to be. So what's a deep emotional why for you?
Vanity.
Thank you. Appearance. Yeah, absolutely. Guys don't talk about that much. How you present yourself, it's huge. In fact, the center that I developed in Borneo was called the Center for Aesthetic Health, based on that principle. If people care, it's highly motivating for people how they present themselves. What else?
Kids and grandkids.
Yeah. Yep. People say that to me all the time. I want to see my grandkids get married, and I say, no, I want to see you dance with your grandkids at their wedding.
That's a goal. I got that one.
Yeah? You checked it off?
No, it's coming.
Oh, sweet.
We're not far away.
Good for you.
I agree with Michael. It's, for me, it's family, and then being able to just live a bright life, a positive life, beyond where you work. because, you know, you can be, it's interesting to use the word, I think, lateral or.
I call it lateral living. Yeah.
I thought that was really interesting because that's, to me, that hit me right away as a flat plane where obviously where you're just so used to and accepting, you're in that mode of like a sheep basically, that where everybody else lives, where you're not going into ascension or climbing and trying to reach that higher level. That now you can look down and go, okay, that's where I was. I'm not doing it.
Yeah.
And then once you get that, then you have that desire to pull other people up,
Yeah.
which is really neat. So,
Yeah. And it's really well said, because every aspect of your life getting up to the top of Maslow's was geared towards the next step, the next thing. And we all grew up with this idea that once we got up to the top of Maslow's, to self-actualization, that we'd be fulfilled and happy. And what I work with guys on in my practice is in the mind domain is whether you read the Harvard Business Review or other sources, it's very clear that you, in order to be fulfilled, you have to be challenged, and you have to have goals, and you have to have a sense of progress towards those goals. When I was wrapping up things in Borneo and felt the call to come home and put the scalpel blade down, it was the hardest transition of my life. So I took a sabbatical, 18 months. I just went around the world, and during that time, I was trying to decide: am I going to be a part of the solution here in the modern era of medicine, or am I going to just keep the golden handcuffs on and keep slicing and dicing 3 days a week in the operating room and play a ton of golf and listen to talks on men's health about why I shouldn't drink so much? But what hit me, I think I was in Cappadocia, Turkey, and I was sitting there at 5 a.m. watching them inflate this hot air balloon. And I'm like, that's what I want to be a part of. I want to be a part of putting potential energy into people's lives, not just making them look more beautiful as a cosmetic surgeon, but actually working with them on the inner home and the total life elevation. And I came up with this idea for myself to decide I'm really going to go after guys and enter men's health, which was, I call it the Purpose Triad, okay? And it's the idea is this is where you plant your butt when your life is on the line. When you're confused, when you're not sure what to do next, the Purpose Triad is decide who you're going to serve. Who are you going to serve? Who's going to be your tribe? Who's going to be your next company? Who are you going to serve? What do you have to learn to serve them at the highest level, a level that you'd be proud of? And then what do you have to sacrifice in order to learn what you have to learn to serve them? Does that make sense? As a filter?
love it because then you're servant leader.
And that is what Harvard Business Review and other psychologists say is a path to fulfillment and happiness, is to get that filter on your mind of who you're going to serve. In other words, it's purpose-led health that will ultimately bring about the greatest fulfillment. And do you know that we did an in-house study of 110 patients, and it was just retrospective. We looked at intake forms from 110 guys. There's one question in our intake that says, what is the biggest piece of your stress pie? Is it finances? Is it relationships? Is it purpose, work? And the top response was purpose. Pretty telling, right? It wasn't finances. Number 2 was relationships. And that's where I want to go next. Looking at your relationship with yourself, okay? A lot of guys are self-medicating with alcohol to manage an imbalance in neurochemistry. One of the really cool aspects to modern medicine is that we have test kits like this. Every month there's a new test kit. We call them specialty tests generically. This one, brand new, make note, is what's called a liquid biopsy. This looks at the top 40 cancers, detecting them at an extremely early stage so that you can do something about it. The top 12, it's got 70% accuracy. After that, it drops off to be about 40%. But this is here, it's to stay. There's a new one, a new liquid biopsy for prostate cancer that looks at 90 genetic markers. And it's going to supplant PSA very quickly to let you know whether or not that PSA elevation is due to prostatitis, you rode your bike too much, or you actually have an early cancer. But the number 2 killer is cancer. And we're now entering, this came into our office last month. So whether you're interested from an investment standpoint, wink, wink, nudge, nudge, or you actually want to utilize this, I'm telling you that the era of the liquid biopsy is here. So other test kits that we use include something that's called the NeuroLab that allows you to collect urine and saliva. And what I see in all of my busy dads, busy executives, is low serotonin, the feel-good neurotransmitter, and low GABA. And the thing about low GABA is a low GABA status will make your nervous system hungry for alcohol. So I tell guys playfully, GABA stands for get another beer already. Right? And what we do preemptively, and I'm not a teetotaler. I grew up with a dad and a brother who made beer, make wine. I love that inner sigh that you get after that first glass of wine. You know what I'm talking about? You just feel that inside. Yeah, that's your nervous system going, thank you for some GABA tonight, because we've been running on empty. Why would you be running empty on GABA? Because every time you think that you have to respond, solve a problem, react, settle a situation at home, your body releases cortisol from adrenal glands. And every time your body releases this chemical called cortisol, a couple things happen. One is your nervous system throws a buffer over that, because cortisol gets edgy after about 30 minutes. Cortisol gets really edgy for you guys after about 30 minutes. So if you're in an argument with the missus, or the son who's not behaving, or whoever, start a timer. And if you start butting up to that 20, 30-minute mark and you're not making progress and you don't feel your blood pressure coming down, what is happening inside of you is you're starting to plaque arteries. You're starting to swell the hippocampus, the memory center of your brain, and you're confusing T lymphocytes and putting you at a higher risk for infections and cancer. For real. Sapolsky and his work at Stanford in the 1980s showed this to us. Yet I don't know a single cardiologist who's measuring cortisol levels. We get to do that. So what do? Let's touch on alcohol for a minute. You got a bachelor party coming up, you're saying? I'll tell you what my recommendations are for alcohol. Number one, understand that have you heard of AFib, atrial fibrillation? Okay. I have 3 men in the past 3 months who come into my practice with new onset AFib, which is an irregular heartbeat, who went through tons and tons of testing, cardiologist, interventional cardiologist, electrophysiologist, and no one, according to them, men are typically poor historians, but according to them, no one sat down and said, look, alcohol is directly irritating to the myocardium of the heart. In fact, in med school, we learned a term called holiday heart, which every spring break, the ERs fill up with young, healthy males who have been drinking too much, and they go into AFib. So it's directly toxic to the myocardium. Alcohol decreases testosterone. It causes a shift in inner hormones so you don't burn fat as well. It might help you get to sleep, but it distorts sleep architecture. So if you wear the Oura Ring or the Whoop or Apple Watch, whatever you use to monitor your sleep at night, and you should, you'll see if you're drinking alcohol that it distorts your sleep quality, your sleep architecture. It also contributes to high blood pressure, and it definitely affects performance in the bedroom by dropping testosterone and confusion with vasodilation in the body. So as far as alcohol goes, this is what I recommend. If you know you're going to have a day on the golf course or a celebration or a graduation where you're going to be consuming alcohol, make sure you have food in the stomach, you're adequately hydrated, and you try to stop drinking 3 hours before bed. Now, my add-ons, if you want to write these down, especially if you've got a bachelor party coming up, are to add 2 to 3 capsules of activated charcoal to help sponge up some of the toxins so that less of it gets into your system, into your liver. There is a product called Hydrus. It's a really good liquid mineral. And then I have my guys take something called Mood Food, which supports serotonin and GABA and really cuts down on hangovers, which tells me it's probably mitigating the side effects of alcohol. If you or a friend is still one of those cavemen who's saying, You know what? I've never had elevation in my liver function test. I've never blacked out. I've never had a DUI, and no one's ever told me I have a problem with alcohol. Therefore, doctor, I don't think I have a problem with alcohol. That's caveman thinking, right? Before those things happen, you're still doing lots of damage to your body. And I would say that metabolically in Milwaukee, it's my number one challenge. After, in the physical domain, after the mindset of shifting them towards a, hey, you can test yourself. Hey, you can take control of your health. Hey, you don't have to go down the same path as your uncle or your dad or your grandpa. My number one metabolic challenge is decreasing alcohol. That's pretty sad, but it's real. Okay, I'll finish up here with a couple thoughts on relationships and sex. Okay, we okay on time, Mike? All right. So we have partnered with a company called Great Relationship Sense, and I'm 22 months into wearing this piece of metal around my finger. So it's my thinking is like I know that real men need to test. I know that real men need to treat what they should find. I know that real men actually need to talk. And so we partnered with this company, and Bill, who runs it, has been teaching me a lot, some of which I want to pass on to you. And the first thing that Bill said to me when it comes to men is he goes, you are 100% responsible for your happiness, contentedness, and joy. You are. She's not, your kid's performance, it's you. And what I have found as I've started to apply that challenge to my guys is a lot of guys don't really know, given 30 minutes, given 1 hour, given 1 week, given 2 weeks, how to fill up their tank. What really fills them up. Do you know? Do you know what fills you up? What fills your inner emotional home? What fills your tank? Gives you a little more buffer, a little more patience, in your relationships. Gives you a little more patience with your staff. What fills you up? Throw something out.
Working out.
Exercise?
I'm going to say a sentence, but it may sound rather trite, or a phrase rather. Spirituality.
Mm-hmm.
I come from a very deep culture. I'm Native American. Although my name is Gonzalez, my father's from Mexico, my mother was full Native American.
Interesting.
Iroquois, and when I had turtle plant. I mention all of that because all of those cultures have directed me to a deep sense of wisdom. And wisdom incorporates the wisdom wheel, and all of those things we're talking about are part of that wheel. So we have to be centered. And yes, it could be good physical health, but also it's balanced with good mental health. And this and that and this and that. So spirituality, for me, is essential to all health. And then how I incorporate your wisdom as a physician, or my wife's wisdom as a person significant to me.
And the home physician.
And
The wife is the home physician.
yeah. And the wisdom of my children. They have a lot of humor, and that's very healing and releasing. So the positive relationships are part of that wheel. It's not an isolated entity.
Yeah.
So it's how we keep ourselves inclusive of purity, of direction, of acknowledgement, and humility, plus probably 20 other traits, which you can imagine they are what we all are.
Yeah.
But that's central to my health.
Yeah.
That's central to my health.
Yep. And I think it underscores this idea of people aren't fulfilled without a sense of purpose. Too. Right. But I think if you are conscious, if you're awake, if you aren't at war or in a tragedy, you can't help. If you're going to truly love yourself as a man, you can't help but ask the question: why am I here? What am I doing? What's it all about?
I think that's one of the biggest roadblocks for most of us in the Western culture is lack of self-love.
Profound statement. No, what is your first name again?
It's Rick.
Rick, yeah. Rick, I can tell you that since I started my men's health practice about 5 years ago, it's probably one of the heaviest things on my heart. It's at the end of a day looking at 8 to 10, 12 patients, whatever. Yeah, because a lot of things fall in line if you're given permission to love yourself. And I want to be really compassionate about the fact that when I talk about the context of America, as an expatriate coming back in 2015, I saw a lot of blockages here in our culture to men being invited to love themselves more and talk more and have book clubs without books and, like talk and express and versus living in Southeast Asia, where I saw more of that. It's a challenge, but it's exciting too, because I think, I heard this week from a patient, a wife whose husband is coming into practice too, and she said, I know he's playing guesswork with me. I know he tries to do the dishes because he wants more sex. And in her mind, there's this kind of negotiation going on, and I said, you're probably right. Like getting in there and coming home on time. I think that they do want to figure out how to please you. It's what they say on the golf course, happy wife, happy life. And it's not, I don't really like that phrase, but there's a lot of, what I think has happened is, I hear a lot of guys wanting to add EQ to their IQ and their GQ. Their emotional intelligence to their IQ and their GQ, their appearance, their aesthetics. And we need to create more spaces where guys can just talk about these things and do it in a way that's safe and non-threatening. John, if you don't know John Knowles, how far did you travel today, John?
To get here?
Yeah.
Oh, an hour.
Yeah, you drove an hour. Thanks really appreciate you coming.
My pleasure.
We were talking today about a men's yoga morning that I've been trying to do on Wednesdays with a yogi from East India who is just phenomenal. And we had a magical Wednesday morning down at Atwater Beach there was 5 or 6 of us guys. And there were 2 ladies that walked up, and I said, you're more than welcome to sit and join. And she said, what is this? And I said, I'm a physician, and I organize this men's yoga. And she said, well, why does it have to be men's? And I said, have you ever gone to a women's event of any kind where there were no men? And she said, yeah, it's quite common. I said, well, do you think that it's good for guys to get out here and talk? And she said, well, yeah, I just think it could be both men and women. So that's a mentality, right? And it's the year 2021. And we're sitting here saying guys need to learn to love themselves more. And they need to understand what drives them. And they need to understand their purpose. And when you do that, the tactics and the strategies and all these things that reflect your ability to love yourself, value yourself, and say, damn it, I'm worth it. A 4th and 5th drink has never done anything for me. I feel pretty good 1, 2, 3. By the time I get to 4 or 5, it does nothing for me. I don't get any greater buzz. In fact, it works against me. But I can tell you the times that I've done that were times where I wasn't loving myself very much. I was trying to self-medicate. John Knowles.
If you don't love yourself and fill yourself up first, you really have nothing to give anyone else. And giving is your purpose, is one of the purposes that bring you joy. Is when you can give something to somebody or at least be a joyful person in the world and share love on a high level. That's a purpose.
Yes.
That the spiritual purpose, a purpose but it starts with filling yourself. I've given the example where if you take a pitcher that has no water in it and you want to share some water, you have nothing to give. If you fill your pitcher up first, you have water to share.
What has stood in the way, gentlemen, of us doing a better job of that?
Ourselves.
Meaning we choose to do what instead?
Well, we're so driven that we lose sight of, we think the purpose of our lives is to make money and to run companies and provide for our families. And, so we're so driven that we think we don't have time to take care of ourselves, that it's not important.
Yeah.
And as you get older, you realize, hey, we better do that, or we won't have anything at all.
Yeah. So most men use the second half of their life using their wealth to try to regain their health, which is infinitely harder.
Well, then you learn after a while that wealth is a lot more than money.
Amen. That's it.
You know, Emerson said the first level of wealth is health, and which you were speaking.
Rick, you had a comment?
Just reflecting on something you said before, and I forget the actual context of it. Excuse me. You were saying something about being invited to. Can you just kind of repeat what you were saying so I get the context?
Yeah, we've had a whole bunch of knuckleheads, cavemen, who have chosen to be, really paying the stupid tax out in society, the Weinsteins and these other guys who, for good reason, put men under the spotlight for, how we think and how we respect or not respect. But the other part, and John was opening up that door a little bit, is we have a dangerous combination historically as men of making our value and love about performance and achievement, while simultaneously being notorious for insecurities, shame, and guilt, and the imposter syndrome. So there's a great study of Fortune 500 CEOs where they went around asking them, do you think that somebody in your organization could run your organization better than you right now today? 80% said yes. So you've got men who aren't talking about, think about it, if those stats are true, 1 in 6, even if it's 1 in 10 men, had some misadventure with their sexuality when they're younger, how many of those, a small percentage, and I'll tell you, I'll be totally candid, I had some of those things crept into my childhood, unfortunately. But how many of them worked through that? Now you've got America, where it's all about getting to the top of Maslow's, right? But you get there with these insecurities, a lot of shame and guilt, especially if you've entered certain religions where just a lot of shaming and guilt. Now you get to the top and you thought that, well, I don't really love myself that much, I'm prone to guilt and shame, but now I've made it. Now it's gonna all be, I'm gonna feel full, because I got this and I got that, it's all lined up. And guys, and then they realize at the end of the day when they're getting ready to go to bed, brushing their teeth, like, this was supposed to fulfill me. And it doesn't. And I'm frustrated, I don't know what to do about it. If the man's central nervous system doesn't have a plan or a pathway, they start getting squirrely, you guys know this. So if the gremlins come out, you're more likely to drink, and you start doing stupid things.
My reference to what you were discussing is that now that I'm retired from my formal position, I do a lot of educational consulting.
Nice.
And it is. And I hate to keep mentioning this, but I have to speak from my background. Being Native American, we have a concept of natural education. And that is our wisdom keepers are with the children. And it's just natural progression then that we learn. So in a sense, we're not invited. In a sense that comes later, or it's more of a formal invitation. It's the natural process of learning how to be centered. And it's beautiful.
From a young age.
Very.
Awesome.
Yeah. We take our people as an example, just as an example, amongst my specific tribal culture. Corn is so important to us. We'll take the children as soon as they are to the field, to the corn, and we'll learn how to husk and celebrate. We're laughing, we're joking, endorphins are flowing. All of this, and that is powerful to overcome self-doubt. But then we're part of community. Yeah. And the community is present then to provide solace to us when times are hard. So that is my consulting right now for the Green Bay Public Schools. It has a large Native population. So to see those young children and then to pair them to a mentor, grandma, brother, sister, father, whomever that might be, produces comfort, and it produces pride, self-reliance, dignity, as well as humor. I keep mentioning humor, but that is so essential to a sense of well-being.
Yeah, but community is probably the single most important thing for longevity. Contrast what you just said to the North Shore, Little League, soccer, swimming, and the parents, and what I see in terms of the stress.
Ulysses,
Well, yeah, but are the kids getting that sort of experience, or is it being instilled very early that your values performance? I can remember walking off the baseball field at Whitefish Bay High School. I was a really good young baseball player, and I had a good game. And I remember walking out of the outfield, and I saw my dad talking with a furrowed brow to a scout. And I was thinking about, are we going to go get some snacks? You know, like I want to go to Dairy Queen. And I walked out and I was like, Dad, are we good? He's like, and he says, you know, if you keep working, you might be able to play in the major leagues. And from that moment on, the whole thing shifted. It wasn't fun anymore. I remember that. And it actually, it worked against the process.
It became an expectation.
Yeah.
It wasn't yours.
Something that I pick up that you're teaching is the community that you're creating for them gives them a sense of being a part of something greater than themselves. And we all need to be a part of something greater than ourselves. It's just ourselves we're working for. It doesn't seem to really fulfill us.
Great comment, John.
I don't think the soccer and the baseball and that is creating that kind of culture of community
Correct.
where they're feeling that belongingness.
it's been competition versus cooperation.
Yes, a big deal difference. Yeah.
Thank you.
Thank you.
Question?
So, just to compliment these guys, so I'm glad I just waited talking and listening because just absorbed that. And interesting image I got as I'm sitting here. It's important for us as men when we're given this kind of thing is to be a sponge. We come in here like rocks. We're rock solid. We got it.
A great line, yeah.
Nothing but sponge. So I'm going, man, I'm glad I didn't talk to you because listen to that. You
We're expected to be rocks.
So it's based on your original question that led Rick started
Yeah.
talking. What was that again, so I can round myself up? It was basically what is it that brings you?
Yeah.
What fills you up so that you can serve from a full well, because you can't serve from an empty well. And it's, yeah, I mean, the big discovery for me traveling through Turkey and was, I was an art major at college, and I had not done any sketching. All through dental school, medical school, residency, I hadn't done any sketching. And it was just like, oh my gosh, that's free and easy. I just got to go sit down a few times a week for 30 minutes and doodle. And I come away, I can tell you my brain waves are better. That fills me up.
It's like
Stretching is good for me. Swimming in Lake Michigan, even when it's 38 degrees, fills me up. It can't be too complicated or too dependent on human beings, right? But certainly being in community fills me up as well.
Yeah, so if I can follow up on that. So for me, it's like I just grabbed onto this life verse. It's Luke 6:38. Given it shall be given unto you, good measure, pressed, stirred, insert, shaken, and stirred until it runneth over. But to do that, it's like through life experiences, I realized you got to get outside of yourself. Because we as men, we are so in
At this point in life.
at this point in
Yes.
life where it's about getting out of yourself and looking outward. And when you're inward, that's where depression kills you and all those things kill you. And you're just self-absorbed as opposed to looking out. And Michael knows this, that when I got to the point where suddenly I was back in the game, mentally, physically, emotionally, spiritually, I said, okay, I'm going to brand myself with a little line, just share the love. So everything share the love. And that's what, we're to do.
Yeah.
And so it's just neat. And to be able to go through and say, okay, how can I do that today? And thinking outward. And when you when you do that, it just gives you such gratification, but you have to protect yourself and say, okay, even though you may have that life verse of Luke 6:38, give and it shall be given unto you, you got to make sure you're giving without expectation. Period.
Yeah.
Because so often we have, okay, if I do this for them, I'm expecting this. And if you're expecting something, you're only setting yourself up for failure. And so if you can just give without expectation, and you just go through and go, okay, I'm going to do that. And what's neat is when you see some of that come back to you. And there are moments where you're going, damn, you know, I wish it would turn, and you just let it go, or something happens, you go, you know what, just keep looking forward, don't go inward, just keep moving. And then next thing you know, you'll get a call or something, you'll hear something, and that, thank God you didn't act that way or react that way, because now that person is reaching out to you because of how you did it, you know, out of love and kindness and so forth. And it's just a neat thing.
Yeah. And there's a physiology to it. There's a physiology to faith. There's a physiology to
There
service.
is, there definitely
There's
is.
a physiology to love
Yes,
and self-sacrifice.
yes.
I can tell you, I've been doing this 20 years, there's a physiology when you mentally, when your head and your heart shift, the body follows.
Yeah.
And when you're not, when you're still caveman, when you're still bound up, when you're not willing to go get help, you're not willing to open up those energy centers, there's blockages. I see it. It plays out in these labs. And I see it among guys most graphically. And then we've got to get our next presenters going here. But I draw a lot of my own blood on my patients. And we've got a half dozen guys who I'll do a venipuncture. And if they get onto a topic that irritates them, like the 17-year-old son who's not behaving, or a bad business deal, or stock market's down, or Fauci, whatever, they'll be, the blood will literally stop flowing.
Really?
And I'll say to them, I need you to take a deep breath. Because I've got the catheter in, and the tube's on, and the blood was flowing, they start getting themselves worked up, and the blood stops. And I'll say, take a deep breath. I wish they were here too, because they would see it's true. And they'll take 3 deep breaths, and the blood starts flowing. And I believe it's, you know, a divine, it's a blessing, because when a man sees that, let me tell you something.
So
He's breathing differently. And we've had about 6 of those moments with guys that, and I think the point of really getting together as number one, I can't tell you how much it breaks my heart to hear guys go into an early grave. You know, I'm 5 years into this practice here in the U.S. after 7 years in Asia, and thankfully we haven't lost anybody yet from my practice prematurely. But we've had a guy, his blood pressure go to 210, and he's hypertensive urgency, and he's texting me from the emergency room. And that was the night he came to grips with his alcohol. And you can see an interview I did with him on our YouTube channel where he says, every aspect of my life changed. And he's the second guy to on camera say, every aspect of my life changed. Every aspect when I gave up or reduced alcohol significantly. And I'm not a teetotaler. I like my wine. But that breaks my heart. And here's the deal. It's completely unnecessary. I've got a woman in the practice who was telling me for 2 years, oh, and the door handle moment. Oh, and doctor, my husband's got to come in and see you. He's just, you know, he's got so much going on. He's always traveling. The guy had a stroke. And she hasn't come in since he had a stroke. She was a regular patient. And I think because she doesn't want to have the conversation about the fact that a dozen times this loving woman has said to a doctor who could help her husband by just doing some testing and doing some education and talking about the head and heart, put him on a different trajectory, that she'd have to sit and deal with the emotions of knowing that his palsy and his non-functioning right arm could have been avoided. But clearly, guys, in this new era, things have opened up. This isn't my dad's medicine. This isn't my dad's culture. This certainly isn't my World War II vet grandfather's culture or medicine. we have the opportunity to take advantage of a very, very open-minded culture right now and get healthcare insight and get coaching and get tested and get treated and get optimized. The question is, are you going to get on the bus? You know, and what I'm telling you is health is a top-down phenomenon. It begins in our mind. Who you are, what you want, and where you're going, what your identity is. And I see physiology follow when we get that figured out. Now, unfortunately, what drives a lot of the revenue in my business are guys acting like cavemen who just, you know, but what we can do in this space, guys, is we can be ambassadors. And I think it's a historic time. I think we're launching a new era in men's health. And it might just be 10 of us sitting here tonight, but this is the only men's-only event in Milwaukee after COVID that I'm aware of that's going on. And when I go to my doctor meetings on the coasts, West Coast and East Coast, I can tell you it's a whole different ballgame. Guys are taking command of their health, they're testing, they're getting therapists, they're getting coaches, and they're enjoying life. I'll tell you what, I have so much more I want to share with you, but what I'd be willing to do is I'll send you my bullet point notes on the relationship tips and some of the sex tips, and then I think we should huddle up again sometime. You guys open to that?
Yeah.
Good time.
Cool. Now, what I think is really cool is we're now going to have a female presenter talking about prostate medicine. But that is perfect as kind of an underscore for this being the new era. Okay?
Scotty's the best. Here's a question. I'm from Phoenix.
Okay.
Actually, I'd love to attend the next one. Can you use
Zoom.
Zoom.
Heck yeah.
Because I'd like to be involved.
Yeah.
There's two.
I can tell you there. So we've got about 60 active citizen scientists, we call them, men in my practice, and the rest are about 60-40 men and women. And there are more and more guys saying, I want the book club without the book. Like, how can we huddle up as guys and chew the fat and then exert our male strength and make this world and our communities a better place instead of living in confusion and sheepish and I don't know how to behave and act and our ladies in our life have a right to be critical of some of the health decisions we make. We haven't gone to the doctor, we haven't listened when we do, and we live a high-risk lifestyle. And that's exactly what the 3 wives told me, which made me miss my consult with this guy.
Do me a favor,
Yeah.
maybe for all of us. Introduce yourself.
Oh, yeah. So, I graduated Whitefish Bay High School in 1991. I left loving football and being the only player on the team running late because I was doing the AP art program also. So I'd run into the locker room late, throw my art supplies in the locker, put on my football stuff and run out to practice. I left Whitefish Bay High School at the age of 16, and my dad stood in the driveway with me and shook my hand and said, you're a man now, you're on your own. Because that's what his dad did with him. So
16?
My birthday's August 14th, so I was done, I was just about to turn 17. And I didn't want to follow the crowd to Madison, and I thought football, and I thought maybe art. So I went to lacrosse, realized that I don't like being a punching bag, and there's no future in football or art. So I went to Madison, did pre-med, I got early entry to dental school, and then after I finished dental school, a little early, moved down to the Caribbean with my parents for a few months in Antigua, and it was there that my mind kind of opened up to this idea of shaping my own path in healthcare. I went to medical school after that at the University of Pittsburgh. I did oral maxillofacial surgery for 5 years, and then I did something that nearly got me kicked out of my residency, which was I added a year of internal medicine. And I went from calling internal medicine doctors fleas to working with them and having to eat crud. It was the best year of my life, and the reason that I mention that is forced adaptation. We get too comfortable later in life. You've got to put pressures in that force you to grow, and we stopped doing that. But after I finished my residency, I went to Honduras, did mission work, And then I took my first job was in central Pennsylvania. And central Pennsylvania, I discovered, is the fencing capital of America. I've had the chance to do some work with Team USA, and all of our fencers come out of Penn State. So I was learning to fence, and I met a French Olympic fencing coach who needed my services, and I ended up taking him to the operating room the next week. And by God's grace, it went smashingly well, and I got an invitation to go to Paris and hang out at their training center. And it was there where I was courted to move to Southeast Asia and build a medical tourism program around, mainly around cosmetic surgery, head and neck surgery. I did that for 6 years, and then I was jogging on a beach in Borneo one day after putting someone's face back together, and it's the only time I think I heard the voice of God, but I heard, we're going home, we're going after the heart of men, and they're financial men, whatever that meant. So I took 18 months and toured the globe, went to the Holy Land, and that's where I ended up in Cappadocia, Turkey, at 5 a.m. looking at this hot air balloon going, I can't just go use the blade to shape lives, I want to deal with the whole person. And so I drew a sketch of this hot air balloon and made the logo, which is the side of the hot air balloon, and came home, and I had to become a patient. So I came home, I was sick, but I had parasites. They had killed a boar in the middle of the jungle, and I got really bad parasites. So I became a patient in the U.S. healthcare system unexpectedly for about 18 months. And that put the exclamation point on me being a part of the solution.
Last question.
Yeah,
What is your name?
Adam Miller.
Okay.
Yeah.
Adam.
Yeah. Thank you for giving me that chance. Thank you so much. This was returning the head and the heart to medicine, which is what I was hoping and praying about.
And the soul.
And the soul. Yeah. Yeah. So really encouraged, and I think we should huddle up again. Yeah.
So it's reproductive length. Okay. And we're going to focus on two main issues that can happen with the prostate, and that would be prostate cancer and BPH. BPH is benign prostatic hyperplasia. You guys heard of that before, BPH? Yeah. So what that means is that the prostate has become enlarged and it's not cancerous, so it's benign. So with prostate cancer, it's actually a really common cancer. 1 in 8 men will be diagnosed in their lifetime. And the good news, though, about that, even though it's a really common cancer, is that most men that are diagnosed will not actually die of prostate cancer. So, meaning that the mortality rate is pretty low. Okay, so that's good news, bad news. With BPH, that is an enlargement of the prostate that happens over time. It affects 1 in 3 men over the age of 50. So there's multiple treatments that can be done for both prostate cancer and for BPH. And the one I'm going to bring up tonight is a prostatectomy, which is the removal of the prostate and the effects that it can have on your life. Okay, so here is a cross-section of a male body. Okay, and so cross-section meaning that would just slice right down the center. And you can see, you know what, this is black, so here we go. Okay, so here is the prostate, and that's a walnut-sized gland, right, like I was talking about, and it sits right underneath the bladder. So you can see that if the prostate became enlarged or full of cancer cells or tumors, that would push up into the bladder, and you would have some sort of urological symptoms. So you could have urgency or the need to urinate quite often, or urinary leakage that could happen because that's pushing up into your bladder and irritating it. The other piece to note is that the bladder has a tube that comes out of it right here called the urethra, which is the tube that goes from the bladder to the outside world. So it's how urine comes out of the bladder. And that runs right directly through the prostate. So if the prostate also is becoming enlarged, it can actually squeeze the urethra and create urinary symptoms as well. Okay? And that's usually the first sign that something is happening to the prostate, is that you start to experience some urinary symptoms.
And those would be wet the urine
Oh,
reciprocation.
you are so good because we're gonna move right on to it here. You guys are on it. So, the symptoms that you could have, and there's more than this, but these are the biggies. You could have increased urgency, okay? So what that would look like is, normally what happens with your bladder is your bladder fills at a regular rate, and you're kind of always aware of how full your bladder is until it gets to the point where you feel like you have to urinate and you make your way to the bathroom. Well, with urgency, what happens is you're not aware of your bladder, not aware of your bladder, and then all of a sudden, boom, you get a really strong urge to go and you have to act on that. So it's a spike instead of like a nice kind of bell-shaped curve urge, okay? So that could be a sign that the bladder's not happy, maybe the prostate's pushing into the bladder. Another symptom would be increased frequency. So the normal, does anybody know how often we normally go to the bathroom? What is normal?
4 times.
4 times, okay. What did you say?
2 hours.
I know, every 2 hours. Okay, that's pretty good, right?
Seriously?
So yeah, about every 2 to 5 hours, okay? If you're over 50, closer to every 2 to 3 hours, okay? So increased frequency would be anything like every hour to every 2 hours. A lot of people are dealing with that increased frequency, and it can be such a pain because obviously it's a big quality of life issue. Difficulty starting urination. So if you think about that walnut-shaped prostate and the urethra that goes right through it, if we're squeezing the urethra, it can be hard to get urine out. You could feel like you aren't able to fully empty your bladder, so you go to the bathroom, urine comes out, but it doesn't feel like it fully comes out. Or you could have dribbling at the end of urination. That's another telltale sign that there might be something going on with the prostate. Okay, so did I say everything I want to say about that? Yes. Okay, so with BPH and prostate cancer, severe cases of BPH can lead to prostate removal. In prostate cancer, it's one of the most common interventions that's done for prostate cancer, is to remove the prostate. So that's called a radical prostatectomy when you take the whole prostate out. Okay, so the good news about having radical prostatectomy is that there's low mortality rate with this prostate cancer. But the bad news that we have with radical prostatectomy is that there can be high morbidity. So meaning that there are some lifelong changes that can happen to a person after they have their prostate removed. And the 2 biggies are erectile dysfunction and incontinence. Okay? So after the prostate is removed, it's basically like an open faucet. Okay, so urine is just going to freely come out. And that gets better over time, but not always. There's a number of factors that can kind of predict as to who's going to have more incontinence than others. And some research that happened not too long ago came up with these stats that urinary incontinence, and urinary incontinence is the leakage of urine. So when you don't want urine to come out, it just comes out. So urinary incontinence is present in up to 54% of cases at 3 months post-op. Okay. And up to 38% of people who've had a prostatectomy are still dealing with urinary incontinence at 6 months post-op. And up to 35% of cases at 12 months post-op. So after a year after having prostate removal, 35% of cases can be still dealing with incontinence. So that's not great because it obviously has a big impact on a person's life.
Are you talking like, sort of like full on and complex, or are they just
Different degrees,
Yeah.
So the most common is stress incontinence, which is, there's 2 different types of incontinence. There's stress incontinence and urge incontinence. And stress incontinence is where you do something that compresses your abdomen and urine would come out. So if you get up from a chair, so you're getting up and you have to use your abs to stand up, that compresses your abdomen, which squeezes your bladder, and urine comes out. Or if you cough or you sneeze, that's the type of incontinence we're talking about. urge incontinence can also be present, but not typically after prostate surgery. Urge incontinence is where you have a strong urge to go, can't make it to the bathroom quick enough. So yeah, in different degrees, definitely. So here's the good news, and this is really my most important slide here, okay? Is there's a lot of research that's going on, and this is kind of piggybacking up about what you're talking about, is you know, this is a very women-run world in healthcare. And when I went into pelvic floor therapy, it was called women's health therapy. And now they've changed it to pelvic therapy because more research is coming out that, oh yeah, men have pelvic floors too. We need to, you know, help them out, you know? So anyway, but I have to say that one thing that I've seen happen over time, and I treat a lot of women and some men, and when treating women, I'm noticing that over the years, patients are really, you know, getting more comfortable talking to their friends about what they're experiencing as far as urinary leakage comes. And so I'm hoping that you guys can be pioneers in that and talk to your friends about this. Because there's a lot of studies that are coming out about how we can help men after they have radical prostatectomies or radiation or any sort of invasive procedure to the prostate. So studies are showing that pelvic physical therapy performed both before and after the removal of the prostate can reduce the incidence, so how often leakage is happening, and the severity, so how much is coming out. And what I'm promoting is that we see patients 1 to 2 times before surgery. So if somebody, one of your friends, is diagnosed with prostate cancer, or somebody you know, a loved one, I would really recommend having them come in before they have that surgery. The nice thing is, usually with a prostate surgery, they have a little while to decide, you know, when they want to have the surgery done. It's not a very fast-growing cancer. So coming in for pelvic physical therapy before and a handful of times after the surgery, because it can be very helpful. In some cases, it can completely eradicate the problem. And the nice thing is, here in Wisconsin, we have direct access, which means that you can come right in our door. And the problem with this is that not all surgeons are aware of this information, and not all surgeons are telling their patients that they should come in for pelvic physical therapy. Or if they are, it's 2 years after, because they're still dealing with these issues. So, so tell your friends and ask them to recommend that they talk to their physician about coming in, or if they don't want to have that conversation, they can certainly come in and we can get the ball rolling for them and consult their physician if needed. So what exactly is pelvic physical therapy, right? Because I really haven't defined that. So pelvic physical therapy is, the reason this was born is really because, oh gosh, I'm not going to do this, right up here. This is another cross-section of your body. So you cut right down the middle. We can see the bladder up there and the prostate, the colon and the rectum. And we have right here your tailbone and your pubic bone. Does that kind of make sense? So this sling right here is muscle. And that's really why I became interested in pelvic floor therapy, is because it's a muscle. It's we are the muscle specialists as therapists. We help muscles get stronger. We help them get more flexible. This is just like any other muscle. It's just at the base of your pelvis and really connected to your internal organs. Okay. So, so that's why pelvic floor therapy exists, because of this muscle. So what do we do in therapy? We, a lot of times, are working on strengthening your pelvic floor with an exercise called Kegels, if you've heard of those. Dr. Kegel, in the 1950s, developed the Kegel exercises. And his goal with Kegel exercises was to improve sexual performance, actually. And so now we're finding that it's actually really important in incontinence. We're going to learn, and I'm going to teach you healthy habits about your bladder, little things that you can start doing to improve the function of your bladder. We'll get you started on an exercise program, so keeping the muscles of your pelvis, your hips, your back, your core strong and flexible really have a big impact on your pelvic floor function. You learn about your prostate and bladder and what you can do to help reduce the leakage. So a big part of what we do to help reduce the leakage is we strengthen this muscle here, the pelvic floor, which is going to squeeze and keep urine from coming out when we don't want it to come out. Make sense?
Can I ask you,
Absolutely.
when they, if you have your prostate removed, what's the relationship between your pelvic floor and your bladder then? Is there a space there?
Yeah.
Or is it right up against
Well,
it?
it changes the urethra, so it makes, I think what happens is the bladder shifts down a little bit, because
Okay.
what I've seen on ultrasound imaging is that the urethra, which looks like a nice, long, skinny tube, after it's removed, it looks much more like a cone funnel kind of thing. And they're thinking that that's part of the reason why incontinence is so prevalent, because the shape of the tube that urine comes out is now more like a funnel, so urine can just flow out much easier. Okay, so what can you do to keep your bladder and prostate healthy? So here's just a few tips that you can start doing right now if you're experiencing any symptoms or want to ward some things off. Limit beverages in the evening. So a lot of times they have patients come in who tell me that they're waking up multiple times a night. If you're over 65, waking up 2 times per night is still considered normal, but we aim to get that down to 1 time per night. But I tell my patients that you want to reduce your beverage intake about 3 hours before bedtime. Limit caffeine and alcohol, right? So caffeine and alcohol are very irritating to your bladder. Yeah. So, you know, that's good advice. That's my advice too. Is, you know, alcohol and water. Diluting the solution in your bladder can be really important. So if you think about if you've got really kind of light-colored urine coming out, you're more hydrated, the solution inside your bladder is a lot less irritating to your bladder. So something like caffeine and alcohol, which can be very irritating, you can, you know, try to dilute that by taking water at the same time. Limit your decongestants or antihistamines. So if you're finding that you have some issues with your bladder, if you're taking a lot of decongestants, that can actually create some constriction around the smooth muscle, which makes it just harder to urinate. Try to use the bathroom every 2 to 3 hours. Okay, the big takeaway here is listen to your body. So if you have starting to have an enlarged prostate, something you're keeping an eye on, and you're having urinary changes, I find a lot of patients are using the bathroom as a just in case. So they're going to leave the house, they may have used the bathroom an hour beforehand, but they just use the bathroom just in case because they'd rather not use it out at the store. And a lot of things, you know, over and over again like that, or that becoming a habit, can actually make the bladder less able to stretch and hold urine. Okay, so it's important that we listen to our body. We try to make it 2 hours between voids, which can help our bladder stretch, and try not to go too far over 3 hours. Staying active, so you know, keeping your weight down, right, is so important. And exercise, we're finding in research, is really the elixir of youth. So trying to stay active and keep your body at a healthy weight can reduce the pressure on your bladder and prostate. Double urinate. So if you feel like you're urinating and you don't feel like you fully empty your bladder every time you urinate, double urinating is a helpful tip that you urinate, and before you leave the bathroom, you try to urinate a little bit more. And sometimes to get a few more cc's of fluid out, which would be very helpful. Lose extra weight, which you talked about, and do Kegels and just exercise in general. So keeping your body strong, doing squats, walking, you know, keeping your legs strong can be so important and has great overflow to your pelvic floor. Okay, so thank you so much for listening. Any questions? Yes.
I got a t-shirt idea for you, since now we're recognized.
All right.
All pelvic floors matter.
Oh, good job. I'll put it in the yard. That is
Are you ready? I do have a serious question.
Yes, please.
We're starting the blue ribbon.
Right. Blue ribbon.
I'm a caregiver for my older brother. longer. He's 68, he's had multiple brain shunt surgeries
Oh,
and so
gosh.
forth. And he's always got an issue where he needs to urinate, go to the bathroom. So he wears Depends. And, but he always needs an assist, so to watch him and observe. So you try to limit that, and then a lot of caregivers will say, well, maybe he has a urinary tract infection.
Right.
So check that, but then we'll check that, and he doesn't have a urinary tract infection. So, and part of it, my sister is a OT, and she said there's a symptom, it's what's a sense of urgency, there's a certain name for it, that he has.
Overactive bladder or
Yeah.
juicer instability. Maybe?
Yeah, there's just this sense of urgency where it's like, I gotta go to the bathroom. Jim, you were just there, no you don't.
Mhm.
And you have Depends,
Right.
so if you have to use them, because you have to be able to pace him, or you'd always be getting him to the
Yeah.
bathroom, so.
Well, that's kind of the thing is, you know, he could need training on how to get the bladder to stretch a little bit more, and you know, also that what goes along with that is just being able to, you know, feel your bladder getting a little fuller, and oh, it's okay. I'm not going, you know, it's
Right.
not going to be a problem.
Right.
Otherwise, I wonder if anything could be irritating the bladder. So if you could check and see, has he been having regular bowel movements? That's a really big one. So a lot of people are running a little constipated, and the bowels are right next to the bladder.
Mhm.
So if you're running a little constipated and that's pushing on your bladder,
Right.
that could be an irritating thing. Is he drinking enough water, you know?
Yeah, I think he could drink more water, he's
Mhm.
try to keep him regular, he's on a really good nutritional
Oh, okay,
plan that I have him on.
Good, yeah.
So that's good, but it's but the self-defeating thing for him is, I don't wanna drink all that water, because I'm just gonna have
That's
to go to the
exactly
bathroom.
right.
So
That's what
you
the,
You gotta
deal with
stay
a lot.
hydrated.
Yeah, exactly. But
So,
it is important, you know, 60 to 80 ounces is what I typically recommend. Do you have a recommendation? Do you go by the weight divided by half an ounce?
I usually just tell these patients 2 liters a day.
2 liters a day.
Yeah. And I think that hydration is going to be a theme in the new era.
that's.
I think that most people will say as they increase water intake, they pee more frequently and more volume. And I think it's, you know, everything at a cellular level is dependent on an osmotic gradient. And that's where Hydrus, at least on paper, and I hear this from people, if they take Hydrus at night, which is minerals, it is getting minerals into the cells, so then the water they're consuming is getting into the cell. You want cells that are like grapes, not raisins.
Right.
Most of us are running around with cells that are more like raisins.
Right.
So the machinery in that cell isn't working as well.
Right.
You know, the bladder, you should have the urge to urinate at about 350 to 400 cc's a year. And it's just from doing anesthesia. But remember this. I did a retreat when I first got back from Asia with a buddy of mine who's a health coach in Vancouver. And we measured our urine. So we arrived in Tofino on the island outside of Vancouver, and every time we urinated, we were peeing into a measuring cup. And when we
What are you guys doing over there?
This is scientist. But here's the aha moment. The first day, I had almost 800 cc's in my bladder before my nervous system said, dude, you need to pee.
Really?
By day 4, I was down to about 380, 400. So you mentioned constipation. I see that trend, but I also think we're holding, in fact, studies show that people are waiting until they get home from work to pee. But there's a lot of neurologic confusion that we're going to have to address in the new era of medicine. I met 5 years ago at Juneau Park, downtown Milwaukee, a guy named Buck, who had just had his testicles removed for prostate cancer. The way it was explained to him, this was 5 years ago, the way it was explained to him at Freighter, it made him so fearful of the complications of incontinence and other things that he went through castration.
Oh, wow.
And the reason that I met him and started talking to him is that he was short of breath in the park. And I said, you know, we sat down and talked, and sleep apnea and this and that. And I said, have you had your testosterone checked? And he goes, I don't have any. Well, yeah, you do.
What?
No, I had my testicles removed. My point is, like, this, there, and you've seen this, I'm sure, Nina, but there's a lot of confusion around prostate health. And the system is set up just to run people through and paying things that will be paid for by insurance.
Yep.
But the trend, so the guidelines for primary care medicine and prevention is less and less running PSAs. PSAs can go up because you rode your bike this weekend. It can go up because of a aseptic prostatitis. PSAs can go up because you may have an early prostate cancer or you just have BPH. But I think that the liquid biopsies are really going to help us determine who can keep their prostate and who has cancer and really needs aggressive treatment. Do you find breathing exercises help with the pelvic floor?
Oh, definitely, yeah.
'Cause
It's one of the respiratory muscles.
Yeah, yeah. I mean, we all, especially growing up in America, we experience stress apnea. We know that we're holding our breath. We got Superman breathing going on. You know, young people, they breathe into their belly. They got little Buddha bellies. We breathe deep breath here is all up here, which means it's not going down into the pelvic floor. And I think that has a lot to do with it. We become more and more stressed, breathing up here and less down into the floor.
And that's big in the women clientele that I see, because it used to be that everybody would, the thinking was, you came in with urinary leakage, all you had to do was strengthen the muscle, you know. And now as research is coming out and you're realizing that the muscle is too contracted a lot of times. It's trauma from childbirth and sitting postures and that, so we have to start breathing down into the pelvic floor to get it to elongate before you even think about doing strengthening exercise.
You've heard of sleep apnea, but stress apnea is a very widely recognized thing now.
Wow.
Yeah.
So do you actually say that, I would have never thought the pelvic floor is part of the breathing? Or do you-
Yeah, so it's the complete inverse to the diaphragm. So your diaphragm sits, you know, underneath your rib cage.
Right.
And when you're taking a breath in, as you inhale, your diaphragm drops to help expand your lungs.
Right.
Your pelvic floor also descends at the same time to maintain pressure on your abdomen. So it has to move with every breath. Wow. So,
Yeah,
anyway,
okay.
I'm running over, so I'm sorry. Thank you guys so much for listening and letting a lady
To announce, so when they go home to their wives though, what should they be asking their wives about frequency? Should I do the for themselves?
So,
Is it normal when they cough and sneeze and laugh, they
I
pee?
see what you're saying.
Okay, wait.
No.
Sure.
I think women are starting to kind of know that now, but
Good.
not at first, you know.
And then I'm also an orthopedic clinical specialist. So that's a board certification in orthopedics. So when you're done with physical therapy, you can practice in any setting. And I wanted to do orthopedics, so I did a residency. So I got my doctorate through Marquette, and then I did my recidency through UW-Madison. So sat for that board exam, and then I got certified in dry needling. So I'm through two or three levels with that.
I'm a recipient.
Yeah, it's great, isn't it?
No.
And then I went to the Titleist Performance Institute to learn about what I'm talking to you about today. So yeah.
What is Titleist? I think of golf.
Yep. So it's golf.
You make the golf clubs?
Yeah.
Okay.
So this is centered around, and I'll kind of touch on that, but
Okay.
golf rehab, assessing the golfer, and helping with that. So yeah. So before I kind of get into what that is, I'm going to ask you, okay, what do these following athletes have in common? So we have here. Phil Mickelson. We have Novak Djokovic and John Rahm.
Yeah.
So if you notice, there's different physiques as you look through these guys. You know, when you compare Nadal to maybe John Rahm walking into the 18th, right? But they all are champions in this year in their respective sports. So the cool part about the TPI is that it takes the golfer and it does a screen to help them be more efficient with what they've got. A big, error we find with golfers is that they try and mimic the swing of a pro. you know, okay, John Rahm just won, so I want to swing like him, you know, that kind of stuff. But everybody's body and mechanics is totally different. So the most efficient swing for you is totally different than Dustin Johnson. So this screening process that I take people through is about identifying inefficiencies in their body and trying to optimize what they do have available. And then if they don't have it available, that's where my physical therapy background comes in, and I can help provide, you know, like if there's, and I'll get into it, but if there's a joint that's immobile that should be mobile, we help mobilize that to make you more efficient. So just recently, we were with Somalia. If I leave this, and then I bring up, here we go. Is that share? Yeah. So Phil Mickelson after he won the PGA Championship. Oh shoot. Is that noise working? Once.
Let's try to play through the
Projector. Through the projector?
You try your
Yeah.
internal speakers.
Let's
and
try
see.
that.
There you go. We'll probably hear it.
Body and do it the right way. And now with the exercise physiology and technology that's out there, like TPI and everything, that you can work out the right way to get your body to function right and play golf for a lifetime. So I'm appreciative of that.
So he's 51. He's the oldest person to win a major, you know, at his sport in golf. So he specifically called out TPI to say thank you, because it's pretty new, this whole process of taking the body and optimizing the individual swing versus trying to match what we think is the perfect swing. So it's kind of cool to hear him say, and I love the point that he said that golf is a lifelong sport and you can play it at a high level forever. Because as you age or as your body changes, you can have different, you know, efficiencies within that swing. So I thought that was pretty cool and well said.
Yeah.
And John Rahm also is a TPI guy too. So 2 of the last big majors have been won by guys who are taking this pathway of, you know, how do I take my body, keep it healthy, keep it mobile, and optimize my swing. So I thought that was pretty cool. So there's that question, you know, what is it? So I'm kind of telling you, but so basically what TPI is, it's a certification that you go through and you learn how to assess the golfer and improve their efficiency. The key isn't the magic swing, the key is to make you so you can like basically continue to use a consistent reproducible swing that works for you. So that's what we do. So, you know, what is, you know, why I see a physical therapist who's TPI certified, it's the point of, you know, the screening process points out your inefficiencies, but a therapist can specifically go in and treat them. So, I mean, if you've been to Freedom at all, you know that we're very hands-on, very one-on-one manual, and that goes a long way with, you know, helping the body move and stay injury-free while you play the sport you love. So, you know, and then, you know, kind of we ask, okay, if I come to see you, what does it look like? So the first session is very assessment-based. We take you through a screening process. We look for these common issues and common inefficiencies that we find along the golf spectrum. And then we try and pair exercises or manual exercise to fit that to you. So it's pretty cool. Any questions on just like the concept of that? All right. So,
I have a question for you.
Yeah.
How long has this program been available?
The whole TPI. So I don't know exactly when it started. In the last 5 to 10 years, it's been a lot more common that people start going through these processes, and like the pros are doing it. Yeah, for sure.
For him to now say it,
Mhm.
Nicholson give it credit is pretty powerful.
Yeah. You're going to see a lot of the pros either referencing it or like videos of them going through the process, because the winners, they're producing a lot of winners. But the huge thing too is the common golfer's not trying to win a PGA championship. They're trying not to get hurt. You know, they're trying not to be sore all the time. So,
Interesting comment.
you know, so that's what this is for. Is Mickelson's comment that you can play for a lifetime and not have these injuries that set you back. That's what I want my patients to come in and see, is like, I don't want my back to hurt the whole time.
I've never heard that comment though. Their goal is not necessarily to win the championship, but not to get hurt.
Mm-hmm.
Interesting perspective.
One of my patients that I was treating with this, he made an interesting comment. I'd mentioned this to him. And he goes, oh, that'd be great. Me and all my golf buddies compare injuries every time we're on the course. Like, you're comparing injuries, like, why is that like a common thing during a sport, right? But, yeah, so this whole process is just designed to find, okay, where are people, and they use science to create this, where are they most commonly injured?
Right.
What are the most common deficiencies that lead to those injuries? And how do we get you back on the course?
Right.
So, you know, we use the example to show people that at the highest level it works, but it works at all levels. You could be a beginning golfer and just try not to hurt yourself or improve a little bit,
Right.
and this works. The other key distinction I should say is, like, I'm not telling you how to swing. You know, a TPI certified therapist isn't a golf pro. We're not telling you you need more leg in your club or try and hit the ball first. We're telling you your back isn't rotating, and if you keep swinging with your arms, you're going to hurt yourself. You know, so
Right.
we try and help you there.
Right.
Yeah. So the other interesting stat that I was reading the other day, the average annual golfer, so this includes the novice all the way up to like the pros, right? They spend about $2,700 on golf expenses per season. Depending if you're a novice or more experienced, the amount of money you spend on clubs is like $1,200 to $1,900. That's an investment in a tool to fix your problems. If you took that money and invested it in your body, you could swing any club you wanted and probably play better than that slice correcting draw driver that worked at the driving range and now it sucks on the course, right? I mean, you know, so $500 for a driver when you could spend, you know, a lot of time, you got $500 to get you 5 visits to work on your body, get treated, and then now you can go play with your old clubs.
Right.
You know, so I just think TPI is an investment in your body to allow you to do anything, and just golf is one of those things it started towards. So I thought that was pretty interesting that much money was spent on, you know, just gear and clubs and everything, you know, and you can invest in yourself.
Is the back the most common injury?
So it's low back pain, just in what we treat, yes. With golf, I actually don't know what is the most common. From what I personally treat, like anecdotally, for sure.
Yeah.
Yeah, it's low back. Yeah. I'm seeing a lot of knee, actually. People tend to, instead of, you know, using their rotation and core, they're twisting knees and swaying side to side. Well, meniscus can only hold so long. It's, you know, and then as the belly's growing, the twisting stops. The meniscus takes a lot of it, so.
Yeah.
But, so that's kind of what TPI is. It's kind of what I do when I'm assessing a person and why we go through it. So, on the screening point, one of the things, just a general overview, the body is designed in alternating joints of like mobility and stability to allow you anchor points and then motion points. So, you know, your shoulder, common for golfers, you need your shoulders, your ribs and upper back, and your hips to be able to move. I think a lot of people think your low back needs to rotate a lot, and there's some rotation that comes there, but it's actually a stability point that you should be creating power from. So any deficiency in one of the joints that creates it to do the opposite will lead to compensation. So for example, a mobile joint, like the hip becomes immobile, you lose rotation, you're going to start stealing that motion from somewhere else. Well, I just said alternating joints have opposite jobs. So if a mobile joint becomes immobile, you're going to start stealing mobility from the adjacent stability joints. So they're going to start doing things they're not supposed to do. And that's where breakdown happens. So the screening process kind of looks, okay, which joint, and it's not just how well do you move, it's are you stable, are you strong, do you have motor control, which areas are you stealing from to compensate for that, you know, impairment. And that's how we go. So it's more in depth than that, but that's kind of the concept of how we work head to toe. So now just some quick takeaways. I'll get you guys out of here, but here are 3 really common things I see, and you can kind of self-assess at home in the mirror or whatever. So one of the most common swing impairment we see is called loss of posture. So the correct way to basically take your backswing is to stay into a squat. So as you take your backswing, you shouldn't be standing up and extending your spine. Now I talked about, just a little bit ago about how some joints are mobile or immobile or more stable. If you're not able to rotate through your thoracic spine, but you still want to get your club back. If you can't rotate, but you still want your club back, you're going to steal that motion from standing up. That's what loss of posture is. So in your mind and neurologically, you've gotten to your parallel or your backswing, but you sacrificed your core, which is where the power comes from. So an arm swing or loss of posture typically leads to this position, and then you'll try and swing back down to get back on plane, and it just leads to a lot of impairment. So really, really common thing, you don't have trunk rotation, you'll do a loss of posture swing, and I see it all the time. The second one is the sway. So if you picture like this vertical line, when you take your backswing, you should not pass that vertical line. The definition of sway is during your backswing when you move past your initial vertical line. So you have your backswing, or you're addressing the ball. This vertical barrier, you should not be swaying past, because your center of mass is now translated to the right.
Okay.
What that typically is, it typically occurs because when you do your backswing, you need to rotate around a vertical axis. The low back is supposed to be stable, so your trunk and your hips are supposed to rotate. This back leg, we define when your foot goes in as internal rotation, foot goes out as external. So on a fixed foot, if your body turns opposite, that's internal rotation of the stance leg. If you can't internally rotate here, in order to get your club back and your weight there, you're just going to shift. So instead of rotating within that vertical axis, people are shifting to avoid any pinching of that hip. So I'll look at that hip, we'll mobilize the hip, and now when you go to your golf pro and he says stop swaying backwards, you don't have to say, well, I'm doing that because my hip hurts, right? It allows you that opportunity. So that's a big one there. And then lastly, the chicken wing. So you have a great backswing, right? Everybody loves practicing the takeaway in the backswing, but the follow through is very important, especially for injuries. I don't know exactly all the mechanics of the perfect swing and follow throws, but I know that people who cut their swings short oftentimes come into me with shoulder or back pain. And you fix that and it goes away. So the chicken wing is often a result, and just some definitions here. So when your arm, so we're going to look at the left arm. When it turns out, that's external rotation, and this is internal. So when you swing a golf club and you follow through, you're supposed to actually end in something around this position. Well, if I let go of the club, and I just showed you this position, that's external rotation. So a lot of people whose shoulders are stiff into external rotation will avoid that by just popping that elbow to get the club through. And that's the chicken wing. So you'll see a lot of rotator cuff tendonitis, impingement, or tears stop their swing because they hit the ball and start chicken winging out because they don't want to rotate that shoulder. So I will.
Is that because it's already injured, or they're injured because of what they're doing?
I can't tell you,
Okay.
but I, like most people, right? If you're 50-year-old male, you probably have some degeneration in the shoulder already, so this is not helping. You know, but then my guess is it's a learned behavior because of avoidance of pain. More often than the opposite. Yeah. So those are the three of the really most common. So just the body swing connection is kind of a coined term from TPI, but you know, the body issue is the limited rotation. The swing issue is the loss of posture. The body issue is the limited hip rotation. The swing issue is the sway. The body issue is the tight lats or the limited shoulder rotation, and you're going to start chicken wing. So if you can address the body stuff, so this is, instead of buying a club that takes away your draw or slice, if you increase your rotation in your shoulder, you probably stop chicken winging, which is why you're probably slicing or something like that. So, and then I just kind of added a slide to remind you guys what I provide. So we give the movement assessment with physical therapy opportunity. I targeted exercises, manual therapies. I'm certified in dry needling. We have cupping, and we have this new awesome therapeutic laser, which is doing some awesome things. Just great ways to improve all those imperfections and impairments to help people be more healthy.
Trent, what do you like about the laser? What's that doing for you?
So, anecdotally right now, people's pain is going down very quickly.
Shoulders, knees.
All over. And then the crazy part is swelling. I didn't really think about that, but during our course and during like the manuals, they talk about like the importance of the vasodilation from the laser and the increased circulation. And we're seeing a lot of like lymphedema and post-surgical swelling that's just kind of pitting, actually kind of reducing and quickly, which is pretty cool.
Is it an ND-YAG or what is it?
You mean this, how
The
it
laser,
works?
what kind of laser?
So, I mean, the laser, right, there's different classes, so we opted to go with the class 4, which is kind of the more expensive, higher grade, so it can generate heat, not that you always, that's optimal, but then within the higher grade lasers you're buying, it's the type of wavelength that is used. So ours can be anywhere from 810 to 980, which is nanometers, which has been shown to therapeutically get maybe 2 to 5 centimeters deep. But then more importantly, that particular wavelength, they just determine the mitochondria in the cell's level. So when that light hits that mitochondria, it increases the cellular activity and movement. So increased oxygenation, blood flow, nerve regeneration. We're seeing great results with like our diabetic neuropathy, peripheral neuropathy people. But the big thing is, pain reduction, but it's through, right, the chemical activation, or probably getting the inflammatory chemicals out of the way, the painful chemical mediators out of the way. And then I just think, again, like we can't talk about just circulation, right? I mean, the value of increasing microcirculation.
Yeah, in some ways it's a non-invasive arthrocentesis.
Correct. Well, yeah,
You're flushing the joint.
Flushing the joint with
Yeah.
tissues. It's pretty. Yeah, and I think it just gets, we talked. I mean, it's not being taught a ton in class still, sadly. Part of it's a very expensive item, so it's not like you're just everybody's gonna go buy one of these. And of course, with the class 4, the beauty of the class 4 for us is we can go up to as high as 60 watts. So what would normally take, like our first unit we bought 20 years ago, take an hour to treat an area like this. Now we can do it in theory 2-3 minutes, but most of our treatments are about 12 minutes, but because of the wattage and power we purchased as well and the depth, you can cover a larger area. So it's pretty nice. Yeah, it's pretty cool stuff right now.
So it's working well so far.
Yeah.
Yeah. A lot of
you
patients
can break that inflammatory cycle in a joint and help slow degeneration. That's an amazing service.
Yeah. So that's been a big, a draw to a lot of patients. I work over in Brookfield.
Okay.
So that's where